DMH NewsLink, your trusted source for the latest in healthcare news.
DMH NewsLink.
Welcome to DMH NewsLink. I'm your host, Michaela Hunt. And when you think about it, cancer can take an extreme toll on the body. Rehabilitation in this day and age can be the key to getting back to yourself. We have Jeff Brown, who's the Executive Director of the DMH Rehabilitation and Wellness Center, with us today to talk more about this. Hi, Jeff. Thanks for being here.
Thanks for having me.
Chemotherapy and radiation is really a part of taking the toll on the body when you're going through cancer treatment. So what is the right kind of rehabilitation after treatment is over?
Well, chemotherapy and radiation can have significant effects on decreasing somebody's strength and tolerance levels. So what physical and occupational therapy specialize in is identifying these weaknesses and developing plans specifically to gain back strength, to gain back function and conditioning so that a person can better fight the disease.
What about scar tissue? Because I can imagine that plays a role in pain after the fact as well.
Anytime you have a surgery, and a lot of times with the chemo and radiation, you're going to develop scar tissue. It can be very painful. It can limit range of motion and strength. And so if we can address it quickly, even before surgery happens, but certainly immediately after, we can go a long way to preventing dysfunction from occurring.
Depending on the type of cancer a person has, does rehabilitation look different?
Yeah, and we've talked about the strength and conditioning aspect, but certain cancers, breast cancer for instance, a lot of the time patients will develop a condition where they have swelling in the arms called lymphedema. And we have specially trained therapists at the DMH Rehabilitation Center that can go in and reduce the swelling either through massage, the use of pressure garments, pumps, exercise, and we can maintain the function of the arm and decrease the pain on top of that.
What is CIPN? I feel like I've heard a bit about that. Can you guys address that in rehab?
CIPN is chemotherapy-induced peripheral neuropathy, and it's you can get damage to the small blood vessels and nerve endings in the hands and the feet. It's painful. It causes numbness and tingling, but it can also affect balance if it's in the feet. And so we are trained to go in and assess that, how bad it is, to try to improve that, but also to look at the other systems that provide balance, strength, and the vision system and the inner ear, and help to maintain those so that patients don't get in a position where they're going to put themselves in harm's way by a fall.
Should a cancer patient be advocating for rehab after cancer treatment, or should the doctor be talking to them about that?
Well, we'd like both. Our hope is with this service line as well as the others that the physicians know that they have the rehabilitation team that they can utilize and will be part of the process of getting their patients back to full health. And we hope that the patients will identify that, and if they need to, they know they can come to us for these problems.
And everything from cancer treatment to rehab is done right here?
Right at the hospital. Not only at the hospital, but we also have several satellite clinics that make it convenient for patients around the area that they can come to.
All right, Jeff, thank you for taking some time to explain that with us today.
Thanks for having me.
And for more information, go to dmhcares.com/news.